All right, you say it's just one missing tooth. It's in the back. Nobody can see it, and if you don't smile too hard, nobody will ever know that it's gone. While that may be true, if left untreated, that one missing tooth can come back to bite you in the wallet. Dr. Bernie Dunson from Donald Denson Design joins us this morning to help you put your money where your mouth is. Good morning, Dr. Dunson. How are you?
Good morning, Karen, and thank you.
It's really interesting. Dental hygiene and a good 401k plan. A great investment is how you see it, right?
Exactly, yes. I'll tell you what we do. One of the things we do in our office is ask the question to the patient, how do you see yourself long term? How do you see yourself in 10 years, 20 years, 30 years as it relates to your dental health and presentation? Inevitably, we get one answer. I want to have my teeth. I want them to be healthy. Well, if you've lost a tooth, unfortunately, you need to think about replacing it. So let's talk a little bit about the things that happen which cause concerns for losing other teeth as a result of this.
So you brought us some pictures, which is very interesting because you don't think it's just one tooth. I'm sure it's what people are thinking. It's just one tooth, but look what happens.
Yeah, a cascade of events occur. As you can see from the illustration there, when you lose a tooth, the teeth in that area start to move. They start to shift. They become compromised. They're more susceptible to decay and periodontal disease as a result. And then they tend to be vulnerable to loss long term.
And then this was what happens next.
And then the other thing you deal with is if the teeth have moved and shifted, then you got a situation where your bite is altered. And if your bite is altered, you got another cascade of events that can occur which could cause tooth loss as well as bone loss. Without the roots of the teeth in the bone, the bone is lost over time.
And that's just one tooth. That is so interesting because then it affects. Do cavities become a factor as well and other things?
These teeth become more vulnerable because they're out of position, as well as the periodontal status or the gum status around the teeth are compromised. So yes, you have an increased chance of bone disease as well as decay associated with the teeth.
Okay, so now we see what the problem is. What are some options for fixing it? And again, you provided some graphics as well.
Historically, the way we as a profession approached replacing teeth was with a partial. A partial is a nice way to do this, except for it has some drawbacks. The drawbacks are it's removable, so you take it in and out of your mouth, and that's obviously unnatural. It also doesn't have the same chewing force if you have something fixed. Another way we approached it is with a fixed bridge. Now, the disadvantage to the fixed bridge is you have to use the adjacent teeth simply by shaving them down, putting crowns on them, and joining a crown in between the two to have a fixed prosthesis that, yes, looks natural if done timely, but it has some disadvantages as well. Now, the modern approach is to place an implant. An implant is dental science's best way to simulate nature, to mimic nature. It gives us an opportunity to place an implant to replace that root and subsequently place a crown, and gives us greater longevity. And if you're missing multiple teeth, that illustration showed where you could have a bridge over an implant.
And I suspect with each option you do have a price range, like the partial, I'm sure it varies.
There is an investment associated with replacing teeth, and it does vary. The national average for the placement of a partial is in the neighborhood of $1,000 to $2,000. For a fixed bridge, considering that you got to have 3 units or more, it's going to be anywhere from $900 to $1,400 per unit.
Wow.
So you can add that up. The implant investment, while long-term a good investment, is probably going to be in the neighborhood of $3,000 to $5,000. Okay? But again, the lifespan of the implant restoration has proven to be much better.
And again, we're talking it's an investment for 20, 30, 40 years down the road.
That's correct.
All right. Dr. Dunson, thank you for that.
Listen,
if you want to get your beautiful smile back, or if you just have some more questions for Dr. Dunson, just go to dunsondental.com, or you can just log into our website, myfoxatlanta.com, and we will have a link.